Hey, it's Naturopathic Medicine Week, and I'm Dr. Briana Botsford, the founder of Flow Functional Healthcare in Edmonton and a naturopathic doctor myself. This week is a time to celebrate naturopathic doctors, whole person care, and taking charge of your health from the inside out. This week, we're sitting down with our patients and colleagues who want to share their unique experience working with naturopathic doctors. Whether you're curious about natural medicine or ready to feel inspired to take action for your health, you're in the right place.
So we're back for Naturopathic Medicine Week, and this is my husband, Ryan McKenzie, the one and only Ryan McKenzie.
There's lots of us, actually.
Are there?
There's a lot. Pretty popular name.
Okay.
Yeah.
Well, this is my Ryan McKenzie, and I wanted to get your take on, a few things like what it's like being married to a naturopathic doctor, what your first impressions were of naturopathic medicine, when we met, and, what's been impactful in your life and your health. So, why don't we start with what your impression was of naturopathic medicine? Like, we met in 2012 in Toronto when I was going to naturopath school and you were going to engineering school.
Yep.
And yeah, well, do you remember what your first thoughts were?
I mean, it just seemed like, okay, she's still looking at cadavers and like she's doing all the other stuff that the traditional medical community does. So I didn't really see it as different, other than like you had more vegetables and you were growing kombucha scobies in your fridge.
I was
and,
making kombucha.
It's like, what are you into? So just different, but like,
yeah.
not that different.
Yeah. So it's funny because our first date, I used to always go on dates on Wednesdays. And the reason that I went on dates on Wednesdays is because we had cadaver lab at the University of Toronto, downtown Toronto, and I was already downtown.
That's where all the good ones live.
That's where all the good ones live.
Go through the Rolodex and like Wednesday.
No, but like that's how we went on our first date. Was after cadaver lab. I met Ryan for juice at like a vegan juice bar type.
I think that's what it does too. Is it like it influences you whether you know it or not? Like I went to a juice bar because like she's an ND or she's a naturopath. I should probably go eat something healthy. Yeah.
And but you weren't healthy when I met you.
You would say that?
No, like you had a cold.
Oh, sure. I was sick. Sure. Yeah. But I don't know if that influenced.
Like, I know, I'm just joking, but like date, I think you had like a beet juice on the date.
Sure. I think I asked you what would be the best, and you pulled out some magic ingredients,
like ginger or something.
And I was like,
yeah, and you like were sweating the whole time.
Magic potion.
Yeah. Okay, but anyways, then we got married. Like fast forward after the post cadaver very sick juice, we got married. And what is it like being married to a naturopathic doctor?
Crazy.
It's crazy.
No, just I think when I look at how we eat versus other people, you're always critical of the amount of vegetables that people eat. And like, I don't know, I think there's a lot of fringe benefits of just diet. When you're cooking for two people, I'm more likely to...
3 now, but yeah.
Yeah, but I mean, like, I'm catering our dinners for you primarily,
right?
Which then benefits me because I know that you have a very high bar for food quality and like, the assortment of nutrients and things that we get in our diet is all you. And not that I am unaware of them, but I wouldn't put the effort into making sure I get all of that if I was just doing it for myself or didn't have if I had a different co-pilot, let's say, who didn't prioritize that.
Right. I want to say critical with kindness because like about food and vegetables and stuff like that. Sure. Like I'm not like, oh my God, can you believe we didn't eat a vegetable?
No, but it's more like, oh, we need something else here, and it's got to be a vegetable.
Yeah, usually. Yeah, and our kid, one of his favorite foods right now is broccoli.
Yep.
Which is hilarious.
It's a phase. He'll get over it.
For sure. But I'm so happy that he loves it right now. Yeah. So yeah, being married to me, we're always like prioritizing vegetables, fruits. Like I think smoothies are something you got really big into.
Juicing, actually.
Juicing was back in the day. Yeah, we don't really do that as much anymore. But the smoothies for sure, we still get those in. And is there anything that you wish people could know, like, about naturopathic medicine or about naturopathic doctors?
Just that there's equally effective ways, and like in an increasing, I know this sounds canned, but in an increasingly unnatural world, it's
Mm.
like, why wouldn't you want to pull harder towards more natural solutions to things? I don't know, just like the forever chemicals and like everything that we're learning about, you know, every year, every decade, there's some new information that's like, shit, like we should, like, we got to stop doing that. And so I think it's nice to know that there's like ways that have always helped people that can still be at the forefront of how we're helping people.
Yeah, so kind of like science is changing and we're acknowledging that like lifestyle behaviors and like
Yeah,
natural.
but also just I like the research that uncovers what the proof of what historic
Uh,
remedies or like natural remedies are, where it's just like,
mhm.
oh, yeah, there is a reason why this is like included in witchcraft remedies for colds. It's like because it actually did cure colds, but it was just like somebody found it in their pantry
Garden,
and or
pantry.
garden and said like, yeah, let's brew this up and see what it does, and sure enough, it worked. But yeah,
Yeah.
that's what I like about natural medicine is it's like leapfrogged off of history and off
Yeah.
of yeah, generational proof.
Yeah,
You know?
okay. Yeah, traditional wisdom and
Yep.
like practices that have maybe like traditional evidence or have been used traditionally and them getting like more scientifically
Yeah.
validated with
Yeah,
updated
validated, I think is a good way.
evidence. Okay, and we when we first met, part of the reason why we met is because I have an Ironman tattoo, and you at the time had gotten into road cycling, and now like
And road running.
and road running. Sorry,
I
sorry.
think that's
Yes,
more of
of
a road
course,
runner, probably.
running. Sure.
So
You had just gotten back from Scotland
true.
on that
Yes.
long bike trip across Scotland. But yes, you were running marathons, half marathons. How has being in a relationship with me and, you know, training together, racing together, fundraising events together, like how has that influenced your performance, do you think, in those events?
Hmm. I mean, always being prepared, having you as a resource or an ND generally as a resource for
Yeah.
like food and like supplement information, things to support your activity
Mhm.
better. I think it's so unknown,
Mhm.
unfortunately, that like everybody underfeels or isn't feeling correctly
Mhm.
for what they want to do. But I think that's a good thing that
Yeah.
I've taken away is always understanding my body better and what it needs
Yeah.
from nutrition and yeah.
Yeah, and then looking ahead, like thinking about, you know, we've been together for a long time. We've been married for 11 years this year. And then looking ahead to like advancing in our lifespan, like what kinds of habits or practices like do you think are going to be supportive or increasingly important as we go forward into our like mid to late 40s and beyond?
I mean, just heart health, like
Yeah.
eating healthy, eating lean.
Hmm.
Yeah, I don't know. I think just leading a healthy, active lifestyle is kind of what is going to keep us going.
Yeah.
So, like supporting it in whatever way we can with like good food.
And exercise.
Yeah, yeah.
Yeah, and our little guy loves to be active. Yesterday, he asked me if we could go for a hike. Yeah,
He's into
so
them.
yeah, he loves hiking and biking, and so I think as a family, we'll be able to keep those things up for sure. Is there anything else you want the people to know about naturopathic medicine, the clinic, what it's like being?
I was thinking about it because
Yeah,
you mentioned we were going to be doing this.
yeah, yeah. It gave you some heads up.
Yeah, but I think like if you could, when you go to the doctor's office and
Yeah,
you say like, oh, something just doesn't feel right. I mean,
yeah,
there's some investigation, but it's pretty limited. And it's sort of like, okay, well, let's do this. And you're probably okay. Things look okay. Like
yeah.
the boat's not sprung a leak. You're not
You're not
sinking.
sinking.
You're okay.
Yeah,
Get up.
yeah.
Not really, but like it's sort of like, okay, well,
We don't have time.
well,
Next.
yeah, you're not critical. Like it
Yeah,
might just be something you have to deal with.
yeah,
And then why wouldn't you want to have the opportunity to pay? Like, what if you could pay your doctor like an extra 100 and be like, no, like let's dig in. Like investigate a little more. Like,
look for
could you
something.
do another test or like figure it out? If you had the opportunity to do that, I mean, that's what I like. It's just like
Mhm,
it's like catering, customizing your anything experience. Like
mhm.
customizing your meal experience,
Mhm.
customizing your car. It's like, why wouldn't you want the freedom to be like, well,
It
like, yeah. And I feel like you're more likely to be advocating for like, it feels like you're more like the pilot of your own ship when you're going into an ND office rather
Mhm.
than putting the boat over to the doctor and be like, I don't know what's wrong, just like fix it. And then maybe tinker with it and like, well, try that, see
Mhm.
how it goes. I feel like NDs are more like, let's go down below deck. Let's see if there's a hole in the boat. Okay, there's
Yeah.
no hole in the boat, but like, hey, there's an engine here and it's not working so well. Like, this could be part of the reason why you're saying you're here and like why things don't feel right. Like, let's just poke around and dig a little deeper. And I think that's what you get out of that experience rather than the traditional Canadian medical system where you have to kind of go in with your
Like a
stated case.
problem.
Yeah, and
Yeah.
it's very reactive and it's not so much like, let's take a look at this and let's like patch you up and make you bulletproof for the future rather than let's fix whatever the problem is and not worry about the other glaring problems that I see contributing to wherever you are right now. So
Yeah, yeah, so we're kind of, like, looking at the whole picture and, like, I love that you're using a boat metaphor because, like, you're an automotive engineer, so of course there's gonna be something with an engine. Like, we're trying to figure out, like, what are the check engine lights that could be
well,
on?
and it's the time taken to explain like the systems that are involved and why the check engine light is on rather
Mhm.
than just like, okay, well, your check engine light is on. This will turn that off.
Off.
It's more
Yeah.
like, well, how did you get here?
Yeah.
And then you can change it.
Yeah, through lifestyle, nutrition, behavior change, like yeah, and then, like, of course, the magic roots.
Potions, yeah. Fairy dust.
Fairy
Yeah.
dust, all of it,
Yeah.
yeah. Cool,
Yep.
well, thanks for doing this with me, Ryan.
You're
I
welcome.
appreciate you.
I appreciate it. Thanks, doctor. Nice seeing you again.
Thank you so much for watching, and a huge thank you to our guest for sharing their story today. If this conversation sparked something in you, don't wait. We're here to help. You can schedule a complimentary 15-minute visit with one of our naturopathic doctors at Flow Functional Healthcare in Edmonton today, or give us a follow, like, or share this video to help us help more people live healthier, more energized lives.